Hey, please watch this short video and you will get the answers you are seeking.
Here is a very basic video for you to look at. This is L5-S1 disc herniation, as you can see more on the right side. And this patient has been suffering for the last 9 months with severe sciatic pain. We are looking at the X-ray and confirming that there is no instability or destruction of the bone. We explained to the patient prior to beginning of surgery what he should expect. I am drawing the midline under the guidance of the C-arm and checking it in the X-ray. Then I am drawing the disc space as you see it in AP, even though I am aware that there is a lordosis. Then I put my marker on the side and measure the depth of the disc and the inclination of the disc. The same distance I take from the midline and shift the second line which I have drawn upwards towards the head to accommodate the tilt of the disc or the inclination of the disc. This cross point is the point where I go inside. I inject lignocaine in syn and subcutaneous tissue. Then I put my needle which goes right up to the foramen. And here I want to check that I am not hurting the L5 nerve root, since this is a foramen of L5-S1. I am trying to reposition the needle and then I inject a dye which would be seen here as black material along the L5 nerve root sheath. Then I push my needle inside the disc and I confirm that I am sitting exactly where I need to be. Then I remove the stylet of the needle and put a guide wire inside the needle, and then I remove the needle. My guide wire is sitting inside the disc where I want it to be, in the posterior quadrant and right up to the midline, and this is a blunt instrument or the dilator which goes inside over the wire right up to the annulus, as you can see here, where the tip of the dilator is in the mid-pedicle line in AP and on the posterior annulus in the lateral. Then I tap this dilator inside the disc under local anesthesia where the patient is fully awake, and then this tip of the dilator goes pretty close and below the disc herniation. Then I pass my working sheath or the cannula over the dilator and I get an access to the disc percutaneously. Now I am showing you the instruments which I use. This is a needle which is 1.2 millimeters in diameter, a guide wire which is 1 millimeter in diameter. This is the scope which has a 3.625 working channel and a 25-degree working. This is for attachment of the camera and the light source. This is a working channel. This is a channel for irrigation or suction. This is the working tube or the cannula which has a bevel at the end which allows us to look up 25 degree and look at the structures which are dorsal easily. Now these are two older cutting instruments called as tree fines which are used for cutting the hard tissue if necessary, and this is a grasper which goes through the scope. This is a 3.5 millimeter grasper which can help us in grabbing the structure which we want to remove. Now in this patient we are going to remove the herniation which is causing the sciatic pain to this patient. You can see the grasper in action, and now this tube would be put inside the cannula. The patient and myself, both of us, are looking at the TV and trying to understand what is going on. I am removing the fragment and I am also asking the patient what is happening, and you can see the patient winces a little bit with pain when I remove the fragment which is causing the pain. After removal of the fragment, the patient is made to lie supine. We check the pain, we check the straight leg grazing, and then the patient is ready to go back to his room in the hospital. The patient's postoperative care is rest for about 24 hours. Then he can go home with the detailed instructions about what to do at home and how to recover from this surgery. Thank you.
Don't wait another minute. Act right now. Spots are limited, and judging by the amount of traffic that we're getting as we speak, I think tomorrow you'll see a big sold out message on our page.